The stages of Lyme disease symptoms.
Please subscribe now and click the bell icon so you don't miss any new videos or updates. That way you will be notified instantly.
There is a lot of information in this video, so make sure you download the free report afterwards. The link is in the description. Lyme disease is caused by the bacteria called Borrelia burgdorferi. The bacteria is transmitted to humans via a bite from an infected tick. The species of ticks that is usually infected by this bacteria is the deer tick, and it is also known as the black-legged tick. Just like any other medical condition, the earlier you tackle it, the better, so it is important you know the early Lyme disease symptoms. It is also necessary to know that the disease comes in 3 stages which are outlined in this video. The first stage of the disease, the symptoms you will encounter usually appear within the first 2 weeks after a bite from an infected tick. The first symptom is the bullseye rash, which is known as Erythema migrans in medical terms. You need to take the symptoms seriously because it is a sign that the bacteria is already spread in your bloodstream. This usually occurs between 3 days and a month after getting bitten by an infected tick. Unlike most other kinds of rashes, it is neither painful nor itchy, but the affected areas of the skin may be warm to touch. Most importantly, the bullseye rash does not affect every infected person. In fact, it has just 50% chance of occurring. If it does appear, it usually disappears in about 28 days. The second stage of the disease. This is the early disseminated Lyme disease, and it gets to this stage after several weeks to a few months of the infection. The stage marks the commencement of the bacteria spreading to other parts of the body. Some of the symptoms at this stage are muscle aches, vision changes, fatigue, sore throat, fever, enlarged lymph nodes, and chills. It won't be out of place to say the symptoms are similar to that of flu. This is exactly why you should always see a doctor for proper diagnosis. Don't assume. Several conditions have similar symptoms. If you already have the rash, it may probably spread to other parts of the body. Other rare but possible symptoms of this stage are muscle droop on the face, numbness, tingling sensation in the body, meningitis, and heart issues. In some cases, symptoms of the first stage do not vanish before second stage symptoms begin to occur. The third and final stage of the disease. This is the late disseminated Lyme disease, and only cases without adequate treatment gets to this stage. The common symptoms of this stage are numbness, mental fogginess, brain disorders, arthritis, heart problems, and severe headaches. At a critical level, patients may also encounter eye inflammation, liver inflammation, and severe fatigue. However, all these are common symptoms, and it does not mean that every patient must encounter every symptom. Some of the symptoms may disappear on their own. This should not be taken to mean that the disease has resolved. Oftentimes some symptoms vanish to give way for more serious ones. Besides, bacterial infections need to be treated as quickly as possible because bacteria spread fast. This disease can lead to life-threatening conditions like problems of the nervous system if not treated properly. I hope this video has helped you understand the stages of the Lyme disease symptoms. Please make sure you subscribe and click the bell icon so you stop missing out on important updates or videos.